Okay, so one of the questions we often get prior to hair transplant surgery is if patients are going to start DHT blockers, such as finasteride or Propecia, when should they commence them? Well, it really depends from person to person, but sometimes, depending upon the clinical presentation, we ask the patient to wait and trial the medication very close to the surgery. And the reason why is in some patients we see the safe donor area a lot lower than other patients. And that's because they can actually have miniaturization extending down into the back of the scalp as well, like this patient. There are some myths going around that hair transplants don't work and that the doctor transplants his hair and it starts to fall out in the next subsequent couple of years. And the reason why these occur is because the surgeons are taking hair from these areas that they think might be safe and they're not sticking to the safe donor area. So as we can see in this gentleman here, that's the back of his scalp, we're actually going a lot lower. We're going to come more into his lateral aspect of the scalp there to take the donor grafts from. But if you look up here, you can see this hair is a lot lighter than this hair, and that's because this hair is at risk of miniaturizing. So we're not going to take any of the grafts from this area here. We're going to stick down low and also come laterally as well. So sometimes that's the reason why we will ask you not to start DHT blocker medications if you are considering surgery within the next year.